this information and getting, when you get home, how to take advantage of all the things that are available in your community. We also have a nice program on vaccinations, what's the latest going on there. We also talk about rehab. If you do have a fall, we have Katie Titus from Christus St. Vincent's inpatient rehab, and then Bernadette is also part of that team where she's talking about outpatient physical therapy. So be sure to log on to us, to our programs. They're all free. They're all online, and we'll be hosting them, starting at the 1st of 2025. So welcome today. This is part of our wellness series, and Villages of Santa Fe provides age-appropriate live, online, and in-person exercise programs focusing on balance, strength, and flexibility, all of which are critical for fall prevention. So today I am Ann Church. I'm the founder of Villages of Santa Fe. This is my new role in life as being a grandmother, so it's lots of fun. We also have with us today Bernadette Romero Jamarillo from Christus St. Vincent Sports Rehab. Outpatient, right? Is that correct? Yes, sorry. There we go. And Maria Francis is a founding member of Villages of Santa Fe. She teaches classes on every other Tuesday and every other Monday and every Tuesday and Thursday. She and I are both master trainers for A Matter of Balance, and she is also a trainer for On the Move. So we are here to talk about falls. So this workshop is designed to reduce the fear of falling and increase activity levels. So what we're going to discuss today is falling is a vicious cycle, the myths about falling, fall statistics, bad habits that increase your chance of falling, what causes falls, what is your risk level, and what to do if you fall. So this is a 90-minute workshop. We're going to have Q&A during the workshop and after the program. This is also being recorded. So if you would like to see this or share it with somebody, we'll have it up probably tomorrow afternoon by about 5 o'clock on our site, which is www.villages of Santa Fe. Just click on the blogs and you'll see it there. So exercise, fall prevention, exercise and other factors to reduce your risk. What is the importance of exercise? What are the ways to be active in the 4 types of physical activity? Endurance, strength, balance, and flexibility. What are your barriers to exercise? We're going to give you some safety tips to exercise. And we're going to talk about the other causes of falls: medication, vision, hearing, nutrition. And then we'll talk about home safety and gadgets for better living. Maria, I believe, let's see, you're going to talk about the impact here.
Yes, falls with or without injury carry a heavy impact on quality of life. So that's what we talk about. Ann and I do those workshops every quarter because we think it's so important. Older adults may fear falling and as a result limit their activities and social engagement. So we're going to talk about how falls is a vicious cycle. Once you fall, your chances of falling again increases. So according to the U.S. Center of Disease Control and Prevention, CDC, more than 1 out of 4 Americans aged 65 over falls annually. Falls are the leading cause of fatal and non-fatal injuries among older adults. So like I said, falls is a vicious cycle. Of patients who are hospitalized for a fall-related injury, 35% will be readmitted for fall-related injury, and 5% will die within a month. So this is a statistic done by Christus St. Vincent 2022 Community Health Needs Assessment. They do this every year, and this is the last one we had. So if you look in this presentation, you see like falls. You have a fall, then you develop that fear of fall. And then what you do, you decrease activities. So by decreasing activity, you reduce your muscle strength, your balance, and your gait. You develop some walking pattern, walking issues that are not good for balance. So you also lose flexibility. So you decrease your functionability to stay healthy and then prevent falls. But then what happens? You fall again. It's a huge increase on people fell 2 or 3 times because the causes is because people limit their social activities and exercise and they stay home. So it's a whole another ball game once you have a first fall.
So we have a bunch of myths about falling, and number one is it happens to other people, not me. And I think if I said who's fallen in the last year, and your doctor's going to ask this when you go see them, have you fallen in the last year? It's quite prevalent. Number two, falling is something normal that happens to you as you get older. And as we're going to walk through all of these myths and risks, you're going to realize there's a lot you can do to mitigate that risk. So let's go with it. So Maria.
Okay, so if I limit my activity, I won't fall. So in reality, some people believe that the best way to prevent falls is stay at home in limited activity, like I talked about a few minutes ago. Not true. Performing physical activities will actually help you to stay independent, as strength and range of motion benefit from remaining active. Social activities are also good for your overall health. The fourth one is, as long as I stay home, I can avoid falling. In reality, half of the, I think it's 25% of people that have fall, it happen at home. So stay at home, inspect your home for fall risk. Fix serious hazard, such as clutter, throw rugs, poor lighting, so many things. We're going to talk about that later. Also about faulty habits that people have developed that eventually they contribute to their fall. So simple home modifications help in that matters as well. Okay, myth number 5, is that mine too? Muscle strength and flexibility cannot be regained. So that's not true either. So we talked about the more you exercise, the better you are for muscle strength and flexibility. So according to the US Centers for Disease Control and Prevention, CDC, more than 1 out of 4 Americans aged 65 up falls annually. Falls are the leading cause of fatal and non-fatal injuries among older adults. Exercise is the only proven way to prevent falls. We always, Ann and I always talk about it, and I wish we had a pill that could give it to people to prevent falls. We don't know anything else can prevent falls, but stay active and keep a strong body.
So
Okay.
myth number 6, medication and vision. Taking medication doesn't increase my risk of falls. And also I don't need to get my vision checked every year. We're going to talk about that later because both of these have significant factors in falls. And if you know those risks, you can know what to do to mitigate that situation. Assisted device, using a walker or cane will make me more dependent. Well, if you feel uncomfortable walking without a cane or a walker, then you're not going to walk. So the main thing is keep moving. So if you need to use an assistant device, make sure you know how to use it. Go to your outpatient physical therapy group and have them show you how to use your device. Make sure you're using it correctly and use it often. Actually, here in Santa Fe, I'll show you some things that we use. We're quite an outdoor city, and people are constantly hiking. We have hiking trails all over, but downtown you'll see people with hiking poles, and with this snow and ice, even just going up my street, which has a pretty steep incline, I was using my hiking poles to go over to my neighbors because I really did not want to slip on that ice.
Okay, the importance of communication. This is a number 9. I don't need to talk to family members or my healthcare provider if I am concerned about my risk of falling. I don't want to alarm them. I want to keep my independence. In reality, fall prevention is a team effort. So bring it up to your doctor, family members, or anyone who is in a position to help. Very, very important. They want to keep you, they want to help you to maintain your mobility and reduce your risk of falls. Please do share with family members, and this is really, really important.
So national statistics, unintentional falls are the leading cause of injury and death among older adults 65 and older in the US and New Mexico. In fact, since we're in New Mexico, we have some statistics for New Mexico in a few minutes, but over $50 billion are spent in medical costs every year. And that's just the money. That's not the resources it takes for you to get rehabbed or to help somebody get rehab. Your whole family at that point is involved, and it is a lot of care that goes into this. So falls are preventable. And falls are also the most common cause of older adult traumatic brain injury, accounting for over 46% of fatal falls. So often you hear, oh, so-and-so fell and broke her hip, but you don't hear so-and-so hit their head and died. And we really do want you to be aware of what can happen if you fall and hit your head and the risk factor of that.
Oh, I'm sorry, I'm seeing a text here. Okay, falls, this is New Mexico statistic, guys, so that's what we're putting out here. So here is 1 in 3 older adults, 65 up, report falling. Okay, so in 2020, 123,687 people, older adults, report falling during previous year in New Mexico. So New Mexico has been very, very active. That's why Ann and I got involved in fall prevention, is because we're, I think, the leading in the whole country. So here, if you take a look, in the last column, the overall is 33.4. So you are 33.1 male and 33.7 female. So females usually have a higher number of falls. Also age. After 80, your chances of falling increases. So if you take a look, we'll have the statistics probably later. I don't know if the next slide or not, Ann, that talks about how the age group is. So very, very important here in New Mexico for us. No, it's not there. Okay, so let's talk about balance problems and disorders. So what causes, what's involved in balance, okay? So it's a combination of 3 systems: vision, proprioception. Proprioception is awareness of the position and movement of the body, your ability of your brain communicating with your muscles. And the vestibular, relating to vestibular, particularly the inner ear, and more generally, the sense of balance. So vision, let's talk about people with cataracts, macular degeneration, stroke. Also, poor lighting can contribute to falls. Blurred vision, changes in the light going from one room to the next room that doesn't have enough light, okay? Proprioception is related to people with neuropathy. If you have neuropathy, it increases your chance of fall. Lumbar spine injury result in altered sensation of the lower legs. Surgeries in ankles and knees also can contribute. Vestibular function being people with vertigo, okay? Also people who had stroke. So those are the 3 components. So if one of those systems are not working properly, your balance is compromised. Okay, so balance problems and disorder again. So do I have a balance problem? So questions to ask yourself. Do I feel unsteady? Do I feel as if the room is spinning around me, even only for a brief periods of time? Do I have a balance and am I had a fall? Do I feel like I'm falling? I feel like lightheaded? or as am I going to faint? I had this issue. I had fall one time before in the gym, and I was feeling like I was fainting, and I did fall. Does my vision become blurred? So those are the things that I want you to ask yourself and pay attention to what happens to you, and if you have those feelings.
So we're going to talk about assessing your risk and do I have a balance problem? And Bernadette Romero Homario, who's the clinical manager of Christus St. Vincent Sports Medicine, is joining us today to talk about the tests that are used for risk assessment. So Bernadette, thank you for taking the time. So we'll go on to one of the first tests here, and if you'll discuss that with our audience.
Absolutely. So as Ann stated, I am a physical therapist and I've been a practicing physical therapist for 23 years. And so we're always concerned on ensuring that our community of our aging community is continuing to be as safe as possible and prevent those falls. So there's multiple tools out there that are available, and this is one. This is called the postural orthostatic hypotension test. And this assesses for any type of dizziness with any changes in position. So this is from the CDC, a printout. So basically taking position from lying down, having the individual lie down for 5 minutes, and then we test for blood pressure in that position as well as heart rate. After that position is tested, we then have the individual stand up for a minute. And we then again test blood pressure and heart rate to indicate if there's a change from lying down on your back versus in that standing position. And then the third step is retesting it again in standing after 5 minutes. And it's testing again the blood pressure and the heart rate. And the outcome of this measurement states that if your blood pressure drops 20 points on the overall, or if it drops 10 from what the diastolic number is, and the diastolic number is your bottom number, and you're experiencing symptoms of lightheadedness and dizziness, that you're showing signs of this orthostatic hypotension. And this is important as our body ages. So it's really important for us to make that awareness of what changes, because a lot of cases we ask ourselves, are we dizzy? Are we losing our balance? Or as both Anne and Maria have stated, is it vestibular induced?
And Bernadette, is this one of those situations where you're getting out of bed and you stand up too quickly and you get kind of, whoa?
Absolutely. So what we do always recommend and give our patients managing tools is when you get out of bed, or even if you're sitting for a prolonged period of time, you want to just stand or sit up from that position for a few minutes just to let your body acclimate. You just don't want to get up and go, because if you get up and go, that could cause a risk for falls. So this is another test that we utilize, an assessment called the 4-stage balance test. And what we do with this particular test is we measure the individual in 4 different positions. So as we measure, this could be done in your physician's office. This could be done in your physical therapy clinic. So we take the individual and we have them test where we're assessing their position in a small base of support. So small base of support is basically narrowing the feet together. So by narrowing the feet together, we put the feet side by side, and we see how long you can hold that position for up to 10 seconds. And then we have you what we call semi-tandem, where you place your one foot just a little bit in front of the other. And again, we test for if you can hold that position for 10 seconds. And then the third position is placing one foot completely in front of the other, which is complete tandem. And again, testing and holding for 10 seconds. And the last position is standing on one leg, which is the most difficult of all four positions. So what we're looking for in all positions is, are you able to hold your balance steady, and are you swaying? Are you needing somebody or a piece of furniture to help hold your balance up? Then that tells us again that you're a fall risk. And a great exercise that we would recommend is, yes, get with a physical therapist, but also practice those positions to help your balance improve in all of those areas that show that may be weak.
So Bernadette, on that practice, you're talking about just every day, just spend how much time? 5, 8 minutes? Just working?
Yeah, 5, 8 minutes a day is gonna be very helpful and sufficient. And then practicing it, really carving out some time within your day and saying, this is what I'm dedicating to work on trying to continue to improve my balance. Also, we would recommend, being near something in the home, such as a counter in the kitchen, as you're practicing some of these tasks, because you want to have something to hold on to, or have a family member be next to you while you're practicing on some of the positions that might be a little bit more challenging, like standing on the single leg.
And so what you're saying also with this is that you are able to improve your balance. You're able to progress from being at this point and progress if you do this on a regular basis, which is then going to help you with your chance of falling.
Absolutely. So the more we practice any type of exercise of balance, movement, flexibility, your body is going to improve. Our bodies are made to move. That's what keeps us from being a less of a fall risk. So another assessment that we utilize for testing for fall risk is called timed up and go. So typically your physician or your physical therapist will set a chair and we'll measure out approximately 10 feet. We'll ask you to sit in the chair and we'll time you as you go from, we'll tell you go, you stand up, you walk the 10 feet, you turn around and you sit back down. And then there's parameters of where a person is a fall risk. Greater than 12 seconds, that's telling us that you're a fall risk. And so again, those are strategies and areas we need to work on improving. And then another assessment tool that's out there is called the 30-second chair sit to stand. And so you're sitting on a chair that's approximately 17 inches in height. And then we measure how many seconds does it take you within, or excuse me, how many repetitions of sitting and standing are you able to complete within a 30-second time frame? And then the scoring is per your age and whether you're female or male in terms of where your standards of below average scores to tell you if you're a fall risk. This is also one of these tools that are very important to focusing, sitting and standing. And you see the individual is actually on the depiction of the picture here using their hands or their arms up and down. You're crossing your arms around your chest and we're seeing what your strength and stability is within the lower extremity and the trunk movement.
You know what I think about these 4 different programs, like the 4 positions on your feet, you can practice at home and you can do that on a regular
Absolutely.
basis. Then you can do your sit to stand by yourself to see if you're helping yourself improve in your fall risk. And then you can talk to your doctor if you're still having problems, ask them to do one or both of those other tests.
And
Absolutely.
Bernadette, can we just do the test and we can give them the results?
Sure, I'll do that. Yeah, okay. Let's do a sit to stand.
Yeah, so then we'll have a list here by age group, and Bernadette can read that, the age group of the people, so you know where you at. This is just an idea, right, Ann? Just an average score, so to know what you are today. Okay.
So I will tell you when to go. So, Maria, you want to demonstrate what this looks like?
Can you see me talking? I cannot see myself. Can you see me?
Yeah, yeah.
Okay, good. Okay, so do I go back in here? Can you see me there?
Yeah, it's okay.
Okay?
Yeah.
You're gonna cross your arms, and then if it's too hard for you to cross your arm, you can use your hands, but the preferable that you put your hand across your body. So when you start, and and then you stand up. This is number one, you sit. Number two, just count in your head the number every time you stand up, and then you know where you are, okay? Is that good?
Now, the key is do not do this with a chair with wheels, all right?
That's right, yeah. Don't do that there. The one is
We want you to hit the chair on the way back down, all right? Okay, so I'm gonna say, okay, well, I'll count down from 3, 2, 1, start. All right, stop. All right. So that's your baseline, isn't it? Burnett, you're gonna people should keep that number?
Absolutely, that is your baseline. Keep that number and try and improve that number by bringing it a little bit further down and so forth. So that will improve that lower extremity strength and that balance.
And if you, I will also, like I said, we're recording this, and in the blog, I'll have all of these sheets up there if you want to download them, so you can get more information, and we'll have that up tomorrow afternoon.
Yeah,
Fantastic.
yeah, okay.
So what if you have fallen? Have you fallen in the last 12 months? Were you injured? Are you afraid that it will happen again? It's very imperative that you do have this discussion with your healthcare provider. And that will help give you the resources to say, hey, do I need to have some therapy to help give me some guidance on this? So another thing we want to teach our patients is you want to become a safe faller. If you're not exercising on a regular basis, you are going to have a higher risk. It's unlikely that you can change the mechanics on how you fall while you're falling. But there are some things that individuals with higher levels of fitness and brain-body connection can do to help minimize the injury during a fall. And some of these things will include.
Sorry about that. There we go. Sorry, I'm going the wrong direction.
That's
There
all
we
right. So become a safer faller by the following. Stay flexible and loose and the ability to move. That's so important. The more flexible you are, the more ability you are to try to help manage that fall. Another tip is tuck your head and look away from where you're falling. And when you land, you want to land on, if you can, what the meat is, like the distribution would be around like the buttock area, what has more muscle. Granted, we lose that muscle as our body ages, but that's going to be a good area because we have a higher risk of breaking a hip or breaking our pelvis. But you want to try to distribute that force when you're falling. And then keep working on falling. It's important for us to get the mechanics. You know, I share this story. My mom, she does this. She's fallen quite a few. She's 88 years old and she's fallen a few times in her life. And And I always tell her, you're a professional faller, because she follows all of these positions that we just talked about, which is staying loose, turning her head and looking the other way, and distributing that force and keeping that movement and that momentum going. But of course, we want to keep you from falling by keeping active and mobile and agile. So some concerns that happen when we do fall, we can end up with an injury, which is called a TBI. It stands for traumatic brain injury. And traumatic brain injury is a result from a violent hit or jolt to the head or the body. You need to follow up with your doctor if you've received a blow to the head or the body, so they can evaluate if you have any changes in your behavior. Also seek emergency medical care if there's any signs or symptoms of a traumatic brain injury following a recent blow or traumatic injury to the head.
And Bernadette, what would they be looking for there? Slurred speech, unconscious?
Yeah, so if you blacked out, if you feel nauseous, if you feel dizzy, increased dizziness, and anything that, if you get a bump on your head, I always explain to my patients that as our body ages, our brain and our skull is more fragile. So talking about direct impact is going to be brain injury, where you have the brain and the skull. So this is a depiction here of where, if you hit the front aspect of the brain, acceleration or deceleration of the brain, injury, and the blast of the brain injury. So these are different depictions of what could happen with hitting the brain. Also, like if we hit the back of our head, we might have a hard time seeing because of where our visual system sits in the back of the brain. But we may end up also with first signs is going to be the concussion symptoms, which can also contribute to this traumatic brain injury, which is headaches, feeling increased pressure of your head, having temporary loss of consciousness, feeling more confused or foggy headed, not recalling or remembering what happened, dizziness, ringing in the ears, as we mentioned earlier, nausea, if you're starting to vomit, as Anne mentioned earlier, if your speech is getting slurred or you're feeling just weak within your body and your muscles. So delayed response to questions, appearing dazed and fatigued, and even having the difficulty with focusing and feeling like the light is too bright. Those are also areas of being aware of a concussion system and traumatic brain injury.
And do those symptoms appear immediately, or can they be delayed?
They can absolutely be delayed. They can be both, but delayed is the big aspect. What we know about how our body ages, too, is in a lot of cases, as we're in our older decade of life, we may show those signs and symptoms. It could be a day later, it could be 2 days later, it could be 3 days later. So it's really important to be aware of your signs and your symptoms.
Yeah, I think that that's really important because you fall and you hit your head, but you don't see anything. There's no blood, there's no whatever. And you're like, oh, I'm going to be okay. And we really want to emphasize that if you have any of these symptoms, please just go to the hospital and they will decide whether you need an MRI or a CAT scan, one of the two.
Absolutely.
Yeah, that's the only way to rule this out. So, yeah. So, Maria.
Okay, now we're going to talk about the bad habits that increase your chance of falling. So as we age, with all the times in our lives, we start developing those habits. I'm going to go over some of the habits, and I want you to make a note what is applicable to you, and then we're going to give you time to share that if you have those issues and how can you fix it, okay? So as we go along with our daily lives, we develop risky behaviors that increase our chance of falls. Follow these simple steps to identify and correct the problem. So let's go ahead and I'm going to give you some of them. I have a huge list, but I'm just for sake of time, I'm going to give you some of them, okay? So one of them is think about yourself. Do you do this or you don't do this? So do you wipe up any slips quickly? So think about it, what you do when you have spills, okay? So do you walk around with floppy slippers, like flip-flops? You know, no back ends on your feet, on your house shoes? Yes or no? When carrying things, I leave one arm free to hold on to rails or stable furniture for support, even though this may mean going twice the number of trips. So this is a very, very, I had people telling me all the time how they go to the grocery store, they come home and they trying to empty the car in one trip. So this is a very common one. So I want you to think about this one. I take my time getting to the phone when I hear the phone. This is for when we didn't have cell phones. Now we have cell phones. So I take my time when I hear the doorbell. I use my cane, walker, or other piece of adaptive equipment as prescribed by my doctor or therapist. I use my grab bar when I get in and out of a tub or a shower. Another one here, let me see. I take my time getting out of bed. It's a big one too. A lot of people fall because they are too quickly. I pay close attention to whatever I'm doing. And this is what I tell my clients all the time. Keep your head on your shoulders. Kind of pay attention to what you're doing, one thing at a time. I have a friend or a relative or a neighbor that checks on me at least once a day or on a weekly basis. I avoid walking on wet or slippery surface and take other paths if it's necessary. And this is, I'm gonna just give you the last one. I turn on a light when I enter a dark room, okay? So let's hear from some of you. I'm gonna allow you to speak. I'm gonna allow you to speak. If you want to unmute yourself and share, if any of these applies to you.
My mother used a rolling walker and
Uh-huh.
insisted on putting laundry and all kinds of other things on top of it. And then she would also walk away from the walker, and she did fall and break her hip.
Okay. Yeah. Really important. Okay. Anybody else? Anything of these that applies to you that you're not doing it, you're supposed to do? Like flip-flops is a big one. Kate, you wanna talk?
Yeah, I have terrible problems with proprioception
Mhm.
and musculoskeletal issues. So if I'm not really attentive to where I'm going, you know, paying attention to where I'm going, I'll walk into walls, furniture, all kinds of things. So I really have to pay attention to where things are and where my body is and coordinate.
Yeah, they're very, very important. It's good.
And
that
it's
you-
hard. It's hard because, you know, you're used to just moving around your house, but I have to like know where everything is, you know, all the time.
Had you had a fall in the past?
Oh, yes. And I've broken bones. Yeah.
Okay. Well, you know now that you gotta pay attention and be
Yeah.
safe, right? Great. Thanks for sharing, Kate. Thank
Sure.
you. June, do you want to say something?
Yes, I'm
Oh, I mute her by mistake. Sorry, June. Mute you by mistake. I'm trying to meet somebody else.
I'm overconfident and I do most of the other things. I'm really quite careful, but I have no one checking on me. not
Okay.
even weekly or monthly. Probably my kids that are on the other side of the country, because I'm in Massachusetts, will
Mhm.
send me a text message maybe once every week and a half. But if I don't respond, they won't think about having a neighbor come and check on. I don't have really close neighbors. I live in the woods. And so I really need to think about that. It isn't any reason why I can't line somebody up to call me or check on me. I just don't do it because I think I'm going to be fine.
Yeah, I think it's a, yeah, that's great. Got somebody to check on you. Absolutely. Good. Great. Thank you for sharing. Anybody else?
I put one in the chat.
Okay, Diane, let me see. Let me read. What do you say, Diane? Yeah, outside, yes, absolutely. We have, especially in Santa Fe, we have a lot outside potential, especially walk on those streets, and yes, absolutely. Okay,
And
thank you.
also when gardening and bending over, I fell into a cactus.
Oh. Yeah, yeah. A garden hose is a typical one that people trying to water their garden, they tripped it on a hose, and so those are the ones that I heard in the past, absolutely. Also, another thing that we talk about is when you're outside, have your phone with you. Something happened, put in a pocket or something, because people say if they're outside and you're not close to the phone and you had a fall, that you'll be there for a while. So make sure that you have a way to call somebody in case that happened. Kate, do you want to talk again?
Yeah, I just wanted to say about the phone, I have an armband that I wear that I put the phone in.
Good.
So it's always on me.
Great, that's a great idea. Kim?
I've known of a couple of people, several, who have fallen because they've tripped over pets.
Mm.
And I've known of others who have fallen on steps. So I think those are two really serious risk areas that you haven't mentioned, but I think they're something we need to be aware of.
Yes, absolutely, especially at night with the pets, if your pet's on the floor, it's dark, the room is dark, and it's gonna talk about safety gadgets, and light's gonna be one of them. So you can see the room. Yeah, pets is very important. Even walking the pets, if people has two pets and they can get tangled in the leash. So very, very, very careful. Thank you, Kim, that's a great one.
Yeah, and just to add on to that too would be throw rugs, right? Those rugs that are really, I know we have them in our homes all over the place. Those are a fall risk for us as well, especially if we have an assisted device to get tripped up on there.
Yeah, yes.
With the throw rugs, so many of us have some really beautiful Navajo or Hopi rugs or whatever. And I was with a client one time and they were like, I can't get rid of my throw rugs. I said, then let's put them on the wall.
They look pretty there. Yeah.
They're very pretty and they're out of the way.
Yeah. Somebody mentioned that some Dansko sandals, they have ankle straps and they're secure on the foot. So it's called Dansko, look in the chat is there. Yeah.
DANSKO. Also, there are a number of sandals that have good straps. You just go pick them out, go to REI and go try some on, and just make sure that your feet are not flopping around in them, so that flip-flops are just something that should be in your past.
Yeah, absolutely. Lori, we have one more.
Yes, when my mother started using the rollator, one of the things that I made sure to do is to open everything up. And I have been in older people's homes where they have little trails that you've got to walk through, which definitely increases the risk of falling.
Yeah, that's one of them. Yes, thanks for sharing. Yeah, Ian's gonna talk about the Apple Watch. That happened to me about the detection, fall prevention detection that Apple Watch has. So we'll talk about that later. Great. Okay, thank you everybody for sharing. Let's
So
move.
Yeah, we're going to go on. We're going to talk about the importance of exercising because, as we have pointed out, there's no pill, there's no building, there's no test. Well, there are tests to tell you whether you might fall, but there's no way to improve your risk of falling that doesn't include exercise. So, we need to understand the importance of exercise in preventing falls. What are the barriers to exercise? Which exercises are best suited for fall prevention, and then creating a daily exercise routine. And Maria teaches balance classes on Tuesday and Thursday and every other Monday, plus specialized classes as well. So she's going to talk about fall prevention and core strength. Oops, I went too far. There we go.
Okay, so this is ways to be active. So when you talk about core strength, is ultimately related to balance because you need good stability at your core to have safe and effective movement at the hip, knee, and ankle. So the core muscles, they're all the muscles, in front of your between your breast and all the way down to your pelvic area. Is those muscles provide stability to the trunk, also supports your spine. They link your upper and lower body and enable you to move a direction or stand in one spot without losing your balance. So those strong core muscles, very important. So if your core isn't strong or stable, it will be impossible for your arms and legs to move well. So the arms will move, the body will do whatever you want it to do, but doing it well, that's the trick. So we talk about, so it's so important for walking, bending, turning, dressing, bathing, let alone the larger movement to sports activities. So very, very important, very important. Safety tips for things you can do to make sure you're exercising safely. Don't hold your breath during strength exercise. Use safety equipment, like if you go to a bike ride, make sure you have a helmet. Drink plenty of fluids during physical activity. Dehydration can cause dizziness and leading to fall. Warm up your muscles before you exercise. So I do a little dance before we exercise my class because I think it's more fun than trying to do warm up exercise. Also, I drink at least 2 to 3 gallons of, not gallons, liters of water a day. So to just hydration, very important. What else, Ann? Endurance, so this is one part of the fall prevention is endurance. So trying to build 30 minutes of activity that makes your breath hard in most days of the week. Walking, dancing, biking. So you also can do, like if you're walking, you can use a little weights, in your hands to improve not just strength, but helps your endurance and make a little harder, okay? That's the endurance part. And then strength, exercise, build muscles. Even though as we age, we lose muscle, but muscle can be regained by exercising. So we use, in my class, we use weights. It doesn't have to be hard, very heavy weights. And that helps with the strength. And balance, simple exercise, like Bernadette said, one leg up, the safety environment, make sure you have something around you that you can hold on to it. Start doing those 8 to 10 minutes a day, one leg up, tandem in place, like one foot in front of each other. So those are the tips that we have given you for balance that I hope you can incorporate it in your daily life. Flexibility, stretching can improve your flexibility. So my classes, I do stretch exercise at the end, about 20 minutes into it. So very, very important. Also, join a gentle class. We have classes online twice a week for gentle yoga, also stretch classes. So make a habit, and your body really will thank you for those flexibility exercise. Okay, so now we talk about mindset. So we might call attitude, belief, demeanor, disposition, frame of mind. I call it mindset. So what that does related to fall prevention. So the relationship between fall prevention and mindset is very critical. especially for older adults or individuals at a high risk of falling. A positive approach mindset can significantly reduce the likelihood of falls, while a negative or fearful attitude increases the risk. So let's take a look at it. So what about confidence in fear falling? So a positive mindset, individuals with a positive mindset tend to be more confident in their physical activities. This confidence encourages them to stay active, maintain good posture, and engage in balanced exercise, which are crucial in preventing falls. So a negative mindset, if they have a fear fall, they might become overly cautious, they even avoid activities that are important to maintain strength and balance. This can lead to muscle weakness, reduced coordination, and ultimately a risk of falls. So also the attitude towards exercise, a physical activity. If you have a positive mindset, a growth positive mindset, you like to view exercise as a viable tool to improve balance and strength. They're more inclined to adhere to a regular exercise routine, which is proven method to prevent. If you have a negative mindset, you believe that physical activity cannot improve your balance, and they're too old or frail to exercise. I hear people telling me all the time, I haven't exercised all my life. I'm a couch potato. I do not care. That does not give you an excuse for not exercise. You can start exercise anytime. So this belief that inactivity also increases the risk of falls. So a very, very important. So in conclusion, fostering a positive and proactive mindset is essential for effective fall prevention. Encouraging confidence, promoting regular physical activity, and nurturing a health perception of aging can empower individuals to take control of their well-being and reduce the risk of falls. Okay. So mindset tips to achieve success. So I start my day with a positive affirmation, okay, every single day. I just think about something positive that I wanted to happen that day. So set small goals for yourself through the day. So don't fill up this big sheet of things that you want to do that you know you're not going to accomplish, okay? So just set some that you know you can accomplish. So be okay too if it's something in your list that did not get to happen. So be flexible in that matter. So take time each day to focus on the good things you accomplished that day. And adopt the habit of writing down things that you're grateful for. So I have a gratitude journal that I write every day, single day, what I'm grateful for in my life. And I also meditate. Doesn't have to be long. I teach a meditation class on Sundays for about maybe 15, 20 minutes, a guided meditation, very, very powerful meditation that teaches people how to create in their own head, their safe space. So if you want to join me, let us know. So, but those are the things that I think that you cultivate a positive mindset by doing some of those things that I suggested. I do every day. So those are my tips.
And then if you have a mindset, we talk about assertive communications and how does that work in fall prevention? Well, the value of good communication with your family and doctors is really important because it's a core skill. And what it helps you do is express yourself and express your rights and beliefs, but without interfering with others. So if somebody says to you, I kind of laugh because, something happens and my daughter will tease me about, well, are you, should I start looking at someplace for you to live besides Santa Fe? And I'm like, hey, let me talk to you about this. I don't have a problem being assertive and saying what I want to do and how I want to live. But it's also assertive communication means you're able to communicate your values and your beliefs without being confrontational or argumentative. You're just saying, these are my beliefs. And that's when that's when you feel more confident talking to your doctor and your healthcare providers and bringing up topics because, as Bernadette knows, and my daughter's a doctor, is that they're not mind readers. They need for you to tell them what is going on with you so they can give a plan, help you achieve your goals as well. So be confident in what your goals are and how to express them. I mean, write them down before you go visit your doctor. Write them down before you go visit your physical therapist. If you've had 3 sessions with your physical therapist and this is working, but this doesn't seem to be getting better, be sure that you're confident and with your communications, that you're clear so that they can help you.
Another thing that we talk about, Anne, is the fact when if you have a fall and especially when you're in public, people show up from everywhere trying to help you, touching you, trying to move you. So be assertive and say, listen, let me assess my body first, because you're in a shock. So if you start moving you and you have heard something really bad, they can make it worse. So then if you are hurting and you need a 911, they tell, hey, you call 911 for me. So that's the things that you have to use assertiveness in case that you have a fall, especially in public. Okay.
I did that. I was on the Santa Fe River, which is actually just a little stream, the other day, and somebody was crossing the stream on the rocks, and it was a group of people, and a lady fell, and like you said, they just ran over to try to get her up, and I said, "Whoa, wait, let's assess how she is, because if she had broken something, you can certainly make it worse. It's better for you just to stop, take a check. Am I okay? Did I hit my head? Can I move?" And then gradually just say, okay, I can get up and you can help me do this, or please call 911. So,
Absolutely.
medication. Yeah.
So now in regards to medications and falls, no risk factor for falls is as potentially preventable or reversible as medication use. 81% of our older adults use at least one prescription drug. 49% of older adults use at least one dietary supplement. 29% of our older adults use at least 5 prescription medications concurrently with non-prescription drugs.
So Bernadette, just how do people, what do they do? I mean, for example, when we did our falls free checkup, we had a pharmacist there, and he talked about the interaction between drugs and the interaction between non-prescription drugs. And that's what is kind of a worry, because you've got 2 doctors or 3 doctors prescribing different things, and you may not have them reviewing that all together.
Yeah, absolutely. It's important to have this conversation with your medical providers. In terms of there's interactions with medications, there's also medications or supplements that could cause some sort of dizziness with some of the side effects. So having the education, having the conversation, just as Anne and Maria were stating, having that assertiveness and be your advocate of knowing what you're taking and how it can affect you in regards to causing you any type of dizziness and so forth. Absolutely.
I think, one of the things I say is that if everybody, I say, who takes statins in the room, like everybody raises their hand, and it's like number 2 or number 3 on the possible drug reactions is dizziness to a statin. And so if a doctor increases or changes your statin or decreases, you have to think about that and realize there might be some changes that are going to be going on, and watch for that.
Yeah, that's a perfect example. Is statins also, many of us are diagnosed with high blood pressure medication, and those high blood pressure medications are definitely needed to help us maintain our blood pressure. But what we do also need to realize too is as our body ages, things change within our body. And again, to have that conversation with your doctor, because sometimes some of those medications can also affect us and do the reverse and cause us our blood pressure to drop lower. So, just being aware of what you're taking and educate yourself is so important. why am I taking this? There's a lot of patients that I'll ask, so do you even know why you're taking this? And they'll say, no, I was just prescribed this. It's so important that we're aware of the why. Why am I taking this medication?
And I guess that really goes to the assertive communication. And if the doctor or the healthcare provider can't clearly explain why you're taking it, then you say, well, let's discuss why I should be taking it. You know, there should be clearly a good result from taking it and not just, well, we think this might work.
Absolutely.
Yeah.
And as we were talking about earlier in the presentation, it is very important to have an annual eye exam. It's part of ongoing screening for helping prevent fall risks from happening. As Maria had pointed out in the earlier part of this presentation, is our body relies on all of our systems to maintain our balance. And having those eyes checked is imperative. Cataract, as we were talking about, just different types of various types of changes that happen with the eyes. So you can have modification if you need to get a new prescription for your glasses or so forth, just to help you in respect of, because we do use our eyes to help us stay balanced. That's probably one of the biggest sensory systems that we use. So it's imperative that we do follow up with those annual eye exams. So regular vision and hearing exams, if your hearing begins to decline, you're at risk of falling. Research shows older adults with mild hearing loss are greater risk and more than double for falling. It's not exactly clear how hearing loss increases the risk. It's known that falls are on the top of the cause of death from injury among people 65 years and older. New evidence shows, sorry
about that. Oops.
That's okay.
Oh,
So
I'm not going the right direction. Hold on. There we go.
yeah, new
sorry.
evidence shows that restoring hearing through the use of hearing aids may also be preventative, especially when people wear them on a consistent basis. According to a study published this summer in the Journal of the American Geriatric Society. So yes, hearing aids are an important piece of maintaining because, again, one of our sensory systems of helping us stay balanced is it is our vestibular system, but also hearing as well. And we also talked a little bit about this earlier in the presentation. Supportive footwear is very important, making sure that it fits well, that it's low heel, that it's non-slip. And especially if you have those sensory problems of any type of neuropathy or numbness and tingling into the feet and into the ankle. Also swelling, chronic swelling in the feet and the ankle can also cause us to have issues with our balance. So it's real important to make sure that you have good footwear to make sure that you don't fall.
Okay, so hydration, I talked about it before. I hear so many different things, opinions about hydration, you know, how many glasses of water a day do you drink? So as we age, that sense of thirsty diminishes. So even when your body needs to be replenished with water, you might not realize it. So persistent dehydration that causes difficulty of walking, confusion, rapid heart rate, or other more severe symptoms can land seniors in the hospital. So I mentioned before, I fell a couple of years ago in a gym. I was training a client and I was very early in the morning. I hadn't drank enough water. So I think I was dehydrated. I got dizzy and I had a fall. So from that day on, I drink a lot of water. I keep water and tea. So make sure that decaffeinated tea. So mix them up. Don't have to be just water. Water is the best. I try to drink more water than tea, but I keep that. I make this big jar of water, put in my kitchen counter or in my studio where I am to remind me that I got to drink water. So very, very important. for that. So please keep it hydrated.
So home safety, that's just another factor. We've talked a lot about clearing the clutter. Extension cords, throw rugs, light it up, turn on the lights. Just turn on the lights. Hold the rails, cut the skids, toss the throw rugs. Another one that we talk about is move it where you use it. So in your kitchen or bathroom, if there's something that you use all the time, make it convenient for you so you don't have to be going up and down a step stool just to get to your coffee maker or your coffee grinder or something that you use on a daily basis. I think that's really important. We do have, and I'll put this up on the blog this afternoon, the checklist from AARP, just a check to go through your home. It's just not a bad idea. Picking up things is very important, not having piles of paper where you could actually just step on the paper and have it slip out from underneath you. In the bathroom, the towel rack is not a grab bar. So, be sure if you need a grab bar to have that professionally installed. And you can find contractors. You might want to check, since so many of you are not in New Mexico, you might want to check with your local state AARP office, because they may have some contractors that they know of that are available to help you with home modifications. So gadgets, I'm kind of a gadget person. One of the things I really like is motion detector lights, and they've gotten so inexpensive and long lived because they're all using these little LED lights now. So you can put batteries in there and they'll literally last like a half a year or longer. So in this picture, I have a garage and I have a step up from the garage. So I have a little small light that comes on the step. So the overhead light is there, but it's not very bright. So before I can get to the light switch to turn on the lighter, the bigger lights, these lights come on, and then another light right by the door. So it really does help light that. Also, going up my stairs, I have 3 sets of these little lights. So I don't have to turn on the big overhead the thing that blows up the world and looks like the sun just came up. I can just go up the steps and these lights come up as I go up the steps. They're inexpensive. I just bought a 6-pack of these little lights like this from Amazon for under $15. And I stick them everywhere. They're wonderful. You can get them like the bigger ones for where you want a brighter situation or whatever. Also, an under the bed light. We're talking about getting up. Many of us have to get up in the middle of the night. That's just what happens. And if you don't want to turn on the light by your bed or turn on the overhead light, there are these lights and they're on a little strip and they stick to the bottom of your bed. And then there's a motion detector sensor that you can either put under the bed so when your foot goes down, it comes on. Or like when I had dogs, the dogs are always turning them on and off. I put it up by the side on the nightstand so I could have that turn on. And it's great because it comes on as a very low light. It doesn't really disturb your sleep situation, and you can time it to however long you want it to go, to stay on. When I was talking earlier, we were talking about our using devices. These are trekking poles. And like I said, around here in Santa Fe, because this is kind of a sports town with a lot of hikers and bikers and people out on foot, I actually keep these in my car all the time. And like right now, we do have a fair amount of ice on the sidewalks, and I will use those because I have no intention of going down and I just don't want to go down. So these are really great. And also I just keep them in my car just in case I need them. They're probably $35 or something like that. But get most everything from Amazon. You can just go to Amazon and Google motion detector lights. There will be hundreds to choose from. Just depends on what size you want, how many you want. Buying a package of 6 for $15 or $16, I think, is a really, really good investment. The other thing that we've talked about is There are devices you can get to wear around your neck. So if you fall, it can make a call for you. But we've kind of gotten hooked on our Apple Watches. Maria and I were very lucky a number of years ago. Apple and Johnson and Johnson had a AFib study, and we got our watches for a very reasonable price. You do have to have an iPhone, but if you fall, 90% of the time it's going to come up with this emergency situation. It says, looks like you've taken a hard fall. If you do not respond to that within, I think it's 60 seconds, and it's buzzing the whole time, and if you don't hit I'm okay, it's going to call 911, and it's going to call everybody on your emergency list that says, I've taken a fall. So the wonderful thing about that is, first of all, you're likely to wear this, because the other things I know people are, I've seen people say, yeah, my kids gave me one. I said, well, where it's in my nightstand. They don't wear it because it's kind of awkward. You're likely to wear your watch. And even if you fall and it doesn't go off, or you do have an emergency, you can actually hold the side button down and it will make an emergency call for you. So all of those things I think are really, really important. Especially, I think somebody mentioned living alone. How many times have you heard so-and-so fell and nobody was there and they were on the ground for a day or so? A friend of ours has Parkinson's. He fell out in his garden and was down outside for probably, I think, 2 hours by himself. And with this, at least you can call and get some emergency help. I think it's really a good look. What do you do if you fall? I think we talked about this. Stay calm. If you have fallen, and Maria, you mentioned if you're out in public, people rush over. You've slipped on the steps, they want to help you get up, but be assertive. Take time to assess your situation, even if you're on the street. Just take time. Check for injuries, breaks, sprains, blood. Just do a checkup on your body. Did you hit your head? Did you lose consciousness? Call 911 or have somebody call 911 for you. The wonderful thing about the emergency responders, they are lovely people. They only want the best for you. If you don't feel like going to the hospital, that's fine. You do not have to go, but they're going to be able to assess the situation for you and make really give you informed information so you can make an informed decision as to what you should do.
And that's when I had that fall, I was by myself in a room and nobody could see me. My client had just left the room, and I woke up with that watch, asking if I had a fall. And I had hit my head and I had a bump in the head and broke my glasses. So the paramedic was there very quickly, and they're just really good looking. So anyway, I went to the hospital, stayed in the hospital for a couple of days because they were doing an assessment, but I insisted for them to do an X-ray, a CAT scan on my brain because I had a concussion, but thank God everything was good. So nothing happened. So this, it can happen to anybody. So
it really does, and it happens very quickly. And at the time, you just want to pretend it didn't. But it did. And your best bet is to be assertive and accept the situation and get an assessment from a professional. And then you're going to feel much better about the outcome of what's going on. And I really appreciate everybody coming. Villages of Santa Fe, we offer 9 classes weekly. We have 3 free classes, 2 free classes online. And we have some specials going on. So if you'd like to join us for the month of December, you can just send us an email and we'd be glad to sign you up for free. We have balance classes. We have yoga. We have Tai Chi. And again, Maria does a Sunday meditation as well, which is really a very nice way to have a calm Sunday. And I want to thank everybody for coming. We do appreciate our sponsors, Krista's Fund, AARP New Mexico, our local Krista St. Vincent's, the Los Campanas Community Foundation, and in Quorum St. Vincent's. We will have all of this information up online later on tomorrow. So if you'd like to be able to click through and find those assessment pieces so you can take some tests or the home checklist, and we will have this recording up as well. So we're going to open it up now if you have questions, and we'd love to hear from you.
You can unmute yourself and we'll be happy to. Do you want to